Scanning.
Just make sure you get my face right over there. Okay?
Hang on. Okay.
Hi, my name is Amber Martins. I'm going to be recording a video validation for nasogastric insertion, irrigation, and removal for nursing 2 skills. Okay, so I have my patient prepped here with a chuck, an emesis basin, and some Kleenex in case he needs to vomit. I have my Salem sump pump here. The clear end of the tubing is to be hooked up to the suctioning device, and the blue part is for me to insert the air into the stomach. And I also have an anti-reflux valve, which just is used to prevent the stomach contents from coming back up into the tube and blocking it. So I've come into the room and I did all my standard pre-steps. I did hand hygiene. I made sure that I had the doctor's orders to do this, like nasogastric insertion, and I also made sure that the patient understood what was going on and understood the procedure. I have the bed at a working level, and I also have the patient placed in a supine or in a Fowler's or semi-Fowler's position, so that they're not choking when I'm doing this insertion. So the first thing that I want to do is an assessment of the nasal, like the nose and the nasal canal. I want to make sure that the patient, I need to ask him if he's had any surgeries on his nose, check for any nasal polyps, or ask for any, if he's had any history of nasal polyps, and also check for any septal deviation or anything like that. And the patient hasn't had any of these, so I'm going to pick the right side to put the tubing into. So the next thing that I want to do is measure. I want to measure from the tip of the patient's nose to the tip of the earlobe, and then from the earlobe down to the xiphoid process. And then this is how much I will be putting into the patient's nasal canal. I have a piece of tape over here, which I will use to mark how far I will be going into the patient's nose. Next thing I want to do is I want to curl the tubing a little bit around my finger so that I have this slight curl in the tubing so that it will go into the patient's nasal canal more smoothly. Next thing, I have some ice water here so that the patient can use this later to be helping swallow. And now what I need to do is I have some lubricant here, and I want to put some lube on the first 4 inches of the tubing. I want to ask the patient to look straight ahead and to lean forward, and I will insert the first 3 to 4 inches into the patient's nose, holding on to the tube the entire time. I want to stop a little bit before the patient actually starts to gag, but they might, and then I will stop after I'm in 3 to 4 inches to give the patient a little break. Make sure that they're okay. If I'm meeting resistance at any time, I would just twist the tubing a little bit and to see if I could get it to go in from just twisting it. If I had assistants here, I would ask them to hold on to the cup of ice water and assist the patient to have drinks while I was inserting the tube. While he's swallowing, I'm going to be pushing it in. So what I want to do is use both of my hands, one to hold on to the tube and the other one to push it in. And the patient is swallowing, and swallow, 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 all the way until I meet the tape here, or until I meet resistance. And then if I'm at resistance, like I said, I would just twist it a little bit. I have a piece of tape here that I'm going to put on the bridge of the patient's nose to hold the tubing in place. And I'm just going to wrap one part of the tube, or the part of the tube with one side of the tape to hold it in place for now while I do my check. So that's being held in place. Now what I want to do is my check. So I have a 60 cc syringe here, and I'm going to fill it with 5 to 20 cc's of air. I'm going to connect it to the clear part of the tubing. And I'm going to put my stethoscope on the fundus of the stomach, just left to the xiphoid process, and while I insert the air into the tubing, I'm going to be listening for a swishing sound. If I hear a swishing sound, then I know I'm in the stomach, which is exactly where I want to be. And another check that I could do is aspirate a little bit of the stomach contents, about 5 cc's or less. Then I would keep the stomach contents in the syringe. I would check the pH of the stomach contents, which I aspirated. If it was between 0 and 4, then I would know that I was in the stomach. If it was above 6 or so, or above 4 even, I would know that I was in the stomach, and I would have to look at replacing that. So then I know that I'm in the stomach, and that's all good. Then the next thing that I want to do is secure the rest of this to my tubing, and to make sure that that's all good. I want to check in the back of the patient's throat. I would ask him to open up his mouth, and I would check in the back of his throat to see if the tubing was coiled at all back in there, because sometimes it gets coiled, and then especially if the patient had a really hard time and was gagging a lot during the procedure, then I would know that it could be a possibility that it was kind of coiled back there and wasn't actually in there properly. The next thing that I would do is take my last piece of tape, and I would secure it with some flexibility, and I would use a safety pin, and I would pin it to the patient's gown so that they still have some room to move their head and stuff like that. So we'll just pretend that that's actually pinned there. The next thing that I want to do is attach the suctioning device. We're going to pretend the straw is my suction. So I would attach the suction, I would turn it on low intermittent suctioning, and I would disconnect my valve here. I would have a new syringe, and I want to insert 5 to 10 cc's of air into this blue tubing. And what this does is it moves the tubing away from the stomach wall, because when I turn the suction, it can get sucked up to the side of the stomach wall. So when I put that on, then I know that it is away from the stomach wall. And yeah, that is how I would do my yeah. Okay, so we're going to pause the camera to start over so that I can